Good morning. This is Taekwondo Hezekiah doing my comprehensive health assessment for my MSN program. My student ID is 000309286, and I have the lovely Miss Tina here who has agreed to be my patient for today. So, Miss Tina, is that okay with you?
Yes, it is.
All right. So, today's date is 12/27/17, and we're going to do a quick review of systems real quick. So, what brings you in today, Tina?
Yearly checkup?
Okay. Are you having anything going on?
No.
Pain?
No.
Okay. Current medications that you're taking?
Albuterol, HCTZ.
Okay. And the albuterol, how often do you take it?
As needed.
And the HCTZ?
Daily.
What milligram?
15.
Okay. Any allergies?
No.
Any childhood issues that you can recall as far as like chicken pox or measles?
No.
Okay. Anything as an adult?
No. Outside of the allergy, the asthma?
Okay. Have you ever had any surgeries?
No.
How many children do you have?
3.
And were they vaginal or cesarean?
Vaginal?
Okay. You ever had any thoughts of harming yourself or anybody else?
No.
Did you get a flu shot this year?
Yes.
Was it within the last 3 months?
Yes.
Have you had a pneumonia vaccine?
No.
Is your tetanus shot up to date?
Yes.
Okay. Any family history of diabetes, cardiac disease,
No.
heart attacks, TB?
No.
Have you yourself ever had diabetes,
No.
heart disease,
No.
coronary artery disease,
No.
a stroke,
No.
tuberculosis,
No.
renal disease,
No.
thyroid problems?
No.
Are you suicidal?
No, ma'am.
Any alcoholism?
No.
Substance abuse, and when I say that I mean like marijuana, opiates, or anything?
No.
Okay. What year were you born in?
1967.
And your education?
High school diploma.
Occupation?
PNA.
Who do you live at home with?
My husband.
And do you feel safe with him?
Yes.
Okay. Do you have transportation?
Yes.
Insurance?
Yes.
Do you live in an apartment or home?
Home.
Is English your primary language?
Yes.
Do you have access to emergency care if you need it?
Yes.
Do you have access to a computer?
Yes.
And what are your interests and hobbies?
Gardening and fishing.
So I'm going to run through a series of questions, just kind of asking you some things that may be going on with you. If it's a yes, just tell me yes. If no, then that's fine as well. Have you noticed a recent change in your weight?
No.
Any fatigue, feeling tired, any fevers?
No.
With your skin, have you noticed any rashes, lumps, sores, itching,
No.
dryness, color change?
No.
Any headaches?
No.
Blurred vision or dizziness?
No, ma'am.
Do you wear corrective lenses?
No.
When was your last eye exam?
Mm,
Can't remember.
no.
Any tearing, like when you just looking at somebody, your eyes start to tear up? Double vision or blurred vision?
No.
Okay. Any problems going on with your ears as far as like ringing in your ears, any infection or discharge?
No.
What about your nose and your sinuses? Allergies? Your throat? Any bleeding gums?
No.
Do you wear dentures?
No.
When was the last time you went to the dentist?
About 6 months.
Any dry mouth or sore throat?
No, ma'am.
Any swollen glands in your neck, any neck stiffness? Do you do self-breast exams every month? Do you know how to do them?
Yes.
Okay. And when was the last time you had a mammogram done?
It's been a couple of years.
Any problems with your lungs as far as a productive cough that you can't get rid of?
No.
Any wheezing?
No.
Okay. Any chest pain?
No.
Any heart palpitations?
No.
Do you get dizzy when you stand up?
No.
You notice any edema, like fluid on your lungs?
Mm-mm.
How's your appetite?
Fine.
Any nausea, vomiting, heartburn?
No.
Do you burp or pass gas a lot?
Mhm.
Okay, which one?
Both.
Any problems with hemorrhoids,
No, ma'am.
constipation,
No, ma'am.
diarrhea?
No, ma'am.
Okay. Have any problems urinating?
No.
Are you sexually active?
Yes.
Okay. With your husband?
Yes.
Do you use birth control?
No.
Have you had an HIV test?
Yes.
Are you still getting your menses?
Yes.
Okay, do you have any bleeding in between it?
No.
Any vaginal discharge, itching, sores, lumps, hot flashes?
No, ma'am.
Any leg cramps?
No.
History of blood clots?
No.
Muscle pain
No.
anywhere?
No.
Okay. Do you ever just feel like you want to faint, numbness or tingling?
No.
Okay. Have you ever had a diagnosis of anemia?
No.
Do you bruise easily?
No.
Have you ever had a blood transfusion?
No.
Do you have any heat or cold intolerance?
No, ma'am.
Okay. Do you ever sweat for no reason? Do you ever feel yourself getting anxious or depressed or just wanting to be by yourself?
No.
Okay. So we will go into the actual physical exam part of it. And how old did you tell me you were, Miss Tina?
50.
So patient does appear to be her stated age. Level of consciousness is, where are you right now?
Macarena VA Hospital. Gainesville.
And what are you doing here? Are you at work?
Yes.
Okay. Who's the president?
Donald Trump.
All right, so patient is alert and ordered times 4. Her skin color is brown. Let me just touch your hand real quick. She's got good turgor. Nutritional status appears to be adequate. She denies any recent changes in weight. If you step up here for me real quick, Tina, I'm gonna get your weight. Patient is 175 pounds. No obvious physical deformities are noted. She has a steady gait. No assistive devices are needed for movement, and she's able to move freely and voluntarily. Her facial expression is congruent with her conversation. Her mood appears to be pleasant. Her affect is appropriate. Her speech is clear and non-pressured with a normal rhythm. She denies any changes in hearing, and she's able to repeat what I say in her ear.
Yes.
Personal hygiene appears to be adequate. No malodors noted. She's groomed in personal clothing. All right, so we've got your weight. It was 175. How tall are you, Tina?
5'6".
Check your blood pressure and your pulse. Are you having any pain right now?
No.
.132 over 68 is your blood pressure. If you just look straight ahead for me, Tina, just looking at your chest, rise and fall, counting your respirations. Respirations are 19, even and unlabored. Let me just check your pulse. Current pulse is 67 radially. Check your temperature. I'll let you put that right on your tongue. temperature was 98.4. All right, Tina, next I just wanna inspect your hands and nails, so if you just hold your hands out for me. And basically, I'm just looking at her skin to make sure that she doesn't have any bruises or cuts, making sure that the skin is evenly distributed about. Color is normal, it's not cyanotic. Temperature is warm, there is no moisture, her texture is smooth. Turgor is adequate, no tinting of the skin, and her skin is free of lesions or growth. So I'm gonna put some more sanitizer on my hand because next I wanna inspect your scalp. Okay, upon inspection of the scalp, her hair is evenly distributed, no lice or growth or infestation. So just look at me, I just wanna see if you can smile. All right, so cranial nerve 7, which is the facial nerve, it emerges from the brainstem and it controls all facial expressions. So we know that that nerve is working because Miss Quinn is actually able to smile. The temporal artery is the artery that supplies blood to the head, and it arrives from the external carotid. So basically it comes from this big artery here and goes up into your head, and this is how the brain is supplied with blood. And we know that you do have adequate blood flow because you have not had a change in consciousness. Next, we want to look at the temporal mandibular joint, and that's basically this joint right here. So I'm gonna put my hands on your jaws and just kind of ask you to open your mouth and close it. Do you have any pain in that area when you do that? Okay. Maxillary and frontal sinuses is this part right here. So a lot of times when people have hay fever, they have pain there. So I'm just gonna press gently right there. You tell me if you have any pain in those areas. Okay. All right, next we're gonna look at your visual fields. The most common visual field test that's used is a light spot that is repeatedly presented in different areas. So basically, like if I had a light and I came over here and said, Tina, do you see this? Or I put it down here, so I'm checking your different visual fields out. All right, so I got my little light, so just look straight ahead and tell me when you're able to see the light. Just hold it hand up. Okay. Like you're in the doctor's office. Okay. All right, so basically I'm coming around with my little light and I'm just gonna check your eye, okay? Now what I'm checking for is just checking your pupils to see if they are reactive to light when I do that, and they are. Next, I wanna look at your eyelashes and your eyebrows to make sure that the hair is evenly distributed, no signs of infestation. Next, I'm gonna check your conjunctiva. This is what doctors check whenever you come in for pink eye, and this little area down here is pink, so I'm gonna put on some gloves to do that. Your pupils were both reactive to light. The purpose of the ophthalmoscope is used to inspect the retina and other parts of the eye. I'm just gonna put your eyelid down just a little, just to make sure we don't see any exudate and that everything is as it should be. Next, we're gonna inspect the external ear, and that's just the outside ear here. So basically what I'm gonna do is palpate the ear area to see if you have any pain or tenderness, and you tell me if I'm doing something that hurts you, okay? You have any pain in that area?
No.
The purpose of the otoscope is to give a view of the ear canal and tympanic membrane or eardrum to check for abnormalities or signs and symptoms of infection. So next we're gonna be testing your hearing. And this is cranial nerve 8, and this is gonna be done by the voice test. And I whispered something in your ear, but I'm gonna speak something else in both ears, and you tell me if you're able to hear on both sides, okay?
Yes.
Can you repeat that back to me?
Okay. I'm almost finished with school. Yay.
All right, so next they would like to hear the explanation of the Weber and the Rennie test. The Weber is a quick screening test for hearing. It can detect unilateral conductive hearing loss and inner ear hearing loss. Conductive hearing ability is mediated by the middle ear, composed of the ossicles, the incus, the malleus, and the stapes. The Rennie test compares perception of sound transmitted by air conduction to those transmitted by bone conduction through the mastoid. So next we're going to move right on down the system and go to your nose. So for the external nose, basically I just want to first inspect it and make sure that you do have a nose and you've got one. Make sure that it's properly aligned on your face. It's not deviated to one side or the other, and it's not. I want to check the patency of your nostrils, and basically I just want to take a finger and close one side of your nose at a time to see if you're still able to breathe. So breathe in. And are you okay? Did you feel like you couldn't breathe when I did that? Okay. The purpose of the speculum is to investigate body orifices such as the nasal mucosa, the septum, and the turbinates. Mouth and throat, lips, and buccal mucosa is pink, moist, and smooth. So now I just want to look at your lips and make sure that you're not dehydrated and look like you're drinking enough water. Your teeth and your gums. So you see? You said it's been about 6 months since you went to the dentist, right?
Mm-hmm.
Okay. Stick your tongue out for me. Next, I'm going to be inspecting your hard palate and your soft palate and just kind of looking at your tonsils and your uvula. So I'm going to stick this on your tongue, and when I do that, you say, ah, so I can get a good look, okay? All right. All right. Hold your head back this way. All right, so tongue is pink, hard and soft palates are present, no lesion or discoloration is noted, tonsils are present, normal size, no swelling is noted. Her uvula was observed via a tongue blade, so she does not have any exudate, so I think we're pretty much good as far as the tonsils go. She's able to move her tongue freely. Next, I want to look at your neck. So I'm gonna palpate. I'm just gonna touch you softly. And I'm palpating the neck to see if I feel any lumps or pulsations, which I don't, outside of your carotids, which would be normal. Cervical lymph nodes do not appear to be swollen. Her carotid pulse is palpable and strong. Her trachea, swallow for me. Her trachea is midline. She is able to swallow. Are you able to turn your head from side to side? Okay. She's able to turn her head from left to right at least a 60 to 80 degree angle. Her thyroid gland is not swollen, and you don't have any pain in your neck area, do you? Okay. Next, we'll move right on down to your chest and your lungs. So, just inspecting Miss Quinn, her chest is symmetrical. We're not going to take her shirt off for purposes of privacy and dignity for this video. Her chest wall does appear to have equal expansion and symmetry. Do me a favor and stand up for me, Tina, and face down. So now, basically what I want to do is check tactile primitive, and this is done by placing both of my hands on her back to assess the vibration from her breathing or talking. If you don't feel anything when she does that, then that may be indicative of a significant health problem. So I just basically want you to just start talking, just start saying your ABCs.
A, B, C, D, E, F, G, H, I, J, K.
Okay. So there is vibration present. You can have a seat here. I should have kept you standing up, sorry. I'm gonna do a percussion over your lung fields and just. Okay. Next, I'm gonna kind of listen to your breath sounds to see how you're breathing, to see if you're clear back there or if you got any gunk in your lungs, okay? I'm gonna start from the front and then I'll work my way to the back. Just take slow, deep breaths in and out for me. upper lobes appear to be clear. I just want to check from the back. Take slow deep breaths in from big breaths. All right, you can have a seat. No adventitious sounds were noted. Her lungs appear to be clear. She has a normal rate and rhythm. There is no pain elicited by percussion of her back overlying the kidneys. So I think this is a repeat of what's in here, but I'll just read through it again. No nodules or blemishes or rashes were noted. Respirations were even and unlabored. No lumps or tenderness. Resonance or a hollow sound is what's normal, and she did have that hollow sound on percussion, and her breath sounds were clear and unlabored. So for this next part, Tina, you're gonna have to get up and do a little bit of work for me. So this is just checking your range of motion and your muscle strength. Just kind of repeat what I do, just checking all of your joints and your range of motion. You can flex your elbows. Okay. She's able to move freely within functional levels. Abduction and adduction is adequate. The epitrochlear nodes, which is part of the lymph system, is located in the medial side of the elbow. So if you just hold your elbow out for me, I'm just going to check some lymph nodes here to make sure. Do you have any pain in that area? Okay. Make sure that it's not swollen. Do you ever get warm in that area sometimes? Okay. So the next process is for the breast and the nipples. I'm just going to talk through that part because we're not going to physically take your shirt off and do that. So to inspect the breast and the nipples and the areola and the axilla, you look for the skin condition, you look for the size, the shape, the symmetry, and the color. You can note the hair distribution in the axilla, which is under the arm. You can compare the breast bilaterally, and in this case, we're not going to take her shirt off. You can inspect the nipples for discharge using 3 finger pads. You would make concentric circles around from the outside of the breast towards the inner, towards the nipple, and then actually squeeze the nipple to see if you have any discharge that is coming out. And you said that you haven't had any discharge, correct?
No.
Okay. Next, we're going to look at your neck. So you can have a seat here. Jugular vein pulse is what we're looking at, and basically this is observed indirectly, the pressure over the venous system via visualization from the internal jugular vein. Next, the presence of jugular vein distension, and this is basically just looking at her neck area right in here to see if it was some type of distension from additional fluid that could be there, and in her case she does not have any. Next, we'll move on to your heart, and I'm going to have my stethoscope so I can listen to a couple things. Okay. Basically, I'm listening to see if I hear the love dub, the S1, S2 of your heart, to make sure that it's beating properly. And I'm just going to go right up underneath your breast. Love dub, love dub, love dub. So I am actually auscultating the apex of the heart to listen to her rate and rhythm, and I'm going to do that for about a minute and do an apical pulse on her. Heart sounds are present. S1 and S2 is able to be auscultated. S1 is the closing of the mitral and tricuspid valve, and S2 is the closing of that brain part. Hold on. Pulmonic valve, I'm sorry. This point where I have my stethoscope is actually the point of maximum impulse. It's the left MCL, and it's right in between the 4th and 5th intercostal space. We got about 68, I believe when we did it earlier radially, it was 67, so let's see. Yeah, apical is off by 1 count. All right, next, Tina, we'll inspect your abdomen. So what I'm gonna do is take my stethoscope and actually listen to the different quadrants of your stomach, to make sure that you do have good bowel sounds, to make sure that there are no sounds that aren't supposed to be there. You have to take your shirt off. Any pain in that area?
No, ma'am.
Okay. I'm gonna do some percussing next, and this is percussing of the spleen and the liver, and you know that it's located mid-clavicular, and don't mind that. So let me know if I'm hurting you. And this is a light palpation and percussing. I'm not going deep. I don't want Miss Tina to have any of that gas she said she had earlier. And basically the difference between light palpation is gently pressing down 1 to 2 centimeters with your fingers on one hand on top of one hand. And then deep palpation is one hand on top of the other, actually pressing down. And for palpation of the liver, spleen, kidneys, and aorta, it's just inspecting first and then actually auscultating with my stethoscope, percussing, and then palpating. So if you'll stand up, Tina, I want to palpate your femoral pulse. So they can see. And John, that you can't now.
No, stop it.
Okay. And they are present. Inguinal nodes located medially to the femoral vein and under the sacrobrium fascia, approximately 35 deep nodes. So lower extremities is next. So we're gonna check for symmetry to make sure that your legs are both the same length, and they, you know, it's one leg that's always a little bit shorter than the other, but you don't have any problems when you're walking with your gait or balance or anything, do you? Okay. So next, I'm just gonna check your pulses. Get behind your knees. Do your pulse. All right, so popliteal pulse is palpable. Next is her posterior tibial pulse, and that is also palpable. If you sit down and take your shoe off, I'm gonna check your pulse in your foot, and that's called your dorsalis pedis. And that also is present. Her temperature and pretibial edema is not present. She's warm to touch, no edema noted. Are you able to wiggle all your toes? Take both your shoes off and let me see you wiggle those toes. Okay, other foot. All right, leave your shoes off for just 1 second. If I was to take my hands and push against put your feet up against my hands. If I was to push your feet, could you push back?
Mm-hmm.
Okay. All right, so full range of motion in her lower extremities. Her strength in both of them are active, and she does have able to provide resistance towards my hands. Neurologically, the sensation of soft or hard touch is intact with her arms, her hands, her fingers, her legs, and her feet. I just want to check your sensation. And I'm gonna take a Q-tip and just kind of rub down your arms and your legs, and you tell me if you feel that, okay?
Yes. Yes. Yes.
Okay. Stand up for me. We're gonna do something next that's called position sense. And this is basically you taking your finger and putting it to, so take one finger and just kind of, without looking, touch your nose, and then do the other one. Okay. Next, I want you to close your eyes, and I'm gonna put an object in your hand, and I want you to tell me what it is that I placed in your hand. What does that feel like?
Paperclip.
Okay, good job. All right, so for cerebellar function, we're gonna do your heel to your shin. So basically just take one heel and just kind of rub down your leg to make sure that you're able to do that with both legs. Are you able to flex your toes?
Mm-hmm.
Okay, and for your deep tendon reflexes, can you, let me check your biceps. Sit up for me. Take your shoes off on me one more time. I'm gonna take something and rub up the bottom of your foot. Yeah. Okay. That tickles. Are you able to walk across the room heel to toe? And basically what I mean is just like heel to toe. And no, this is not cops doing a DUI presentation. Her movements are smooth and rhythmic, and they are coordinated. Are you able to walk on your tiptoes and then walk on your heels? Okay. The Romberg sign checks neural function. You must have 2 out of 3 to be intact to pass, and those 3 properties are proprioception, vestibular function, and vision. Are you able to do a shallow knee bend? Okay. Can you bend forward for me like this and touch your toes? If not your toes, just as far as you go. Bend that one more time. Patient is able to bend forward and touch her toes. Right and left scapula appear to be even. Her hips appear to be even and symmetric and are in line. And that, I believe, is the end of our video. Thank you so much.
You're welcome.